Hi guys, how's it going?
Good. How are you?
Good, thank you. Let's see, it's 1:29. Hopefully everybody got the email or saw the announcement on Canvas. I wasn't sure how many people lived right in town or right next to campus, but I definitely don't. And yesterday I shoveled off about 18 inches off of our deck that had piled up from Friday to Sunday. And then this morning we had another 6 to 8 inches. So we've got a lot. And I made it in yesterday. Sorry, my kiddos are right outside this door right now. I made it down yesterday and it took quite a while and had left before the plows made it out. So I thought this class, it can work really easy just via Zoom. At least today, we'll see what Thursday looks like. Hopefully it's a little bit better. I'm not sure what it's calling for in Lewiston. I do know that when I look at my phone for where I live, it shows snow for about 10 days straight. Just kind of, yeah, it's a little much. So we've got some heaping piles out there, that's for sure. All right, so the way that I like to do this is I'm gonna share my screen. You guys know that you all have access to these PowerPoints right there on Canvas. And so you can access it that way, or you can see it via the screen share, whatever works for you. Oh, I did want to say something real quickly before we started here is I just wanted to say excellent job on exam 1. Okay. Everybody did really well. I think people were really nervous and really worried after our exam review because, you know, I was asking for very particular responses. And the reason I was doing that again is because I was trying to get you guys to just make sure you had the exact right answer and what to look for on that exam. So I think that helped. I hope to help. I think the average was like an 83% or 85%, which is stellar. So great job on that. And I hope that you guys will feel a little bit more comfortable taking the exams to come because now you have an idea of what those look like and what to expect. Do I have any questions about the exam? No? Okay, we have about 3 weeks here where we're gonna make it through chapters 6 through chapter 12 or chapter 11. And those chapters, the last 3 of them are fairly similar, just because it's prescription based on age, but it's all about exercise prescription based on age. So there's not going to be, I think it's a good amount of content to try to grasp for the next exam. Again, it's only 3 weeks, but it's not an overwhelming amount of content and it's not difficult content. And I'll prep you the same way that we got prepped for this last exam. So I'm really confident in you guys and your abilities. All right, I'm gonna go ahead and share my screen. And if you have a question while we're moving here, please just start talking because depending on how this, sometimes the way I situate it, I can't see everybody. I can only see a couple people at a time. So just unmute yourself and it's okay to butt in and ask the question. Don't feel bad about that at all. All right, let me get this up and ready for you guys. It's gonna be kind of crazy for just a second here. See yourself, perhaps. All right. Okay, can everybody see? Actually, I'm gonna do this a different way, guys. so it doesn't get super crazy on us. Okay. Can everybody see the slide that says chapter 6, enhancing your muscular fitness? Just give me a nod, thumbs up. Yes. Awesome, thank you. All right, so chapter 6, enhancing your muscular fitness. This is when we're going to start to move into how to prescribe exercise and what those fitness components were, really kind of diving into those fitness components. We talked about aerobic fitness, that was on your first exam, and we'll see if we can get the VO2 max squeezed in before the end of the semester face-to-face. If not, I will just assign it to you guys outside of class. But muscular fitness, as well as neuromuscular fitness and flexibility, we will do those labs together in class. And so I'll let you know exactly what day that's going to be coming up, and that way you'll know how to dress down and then also where to meet for that. So the benefits of muscular strength and endurance, we know there's improved performance with any activities that you're doing, okay? I'm even thinking right now about shoveling snow. That's a workout. And if you have not been exercising, you have not been lifting weights or doing any type of strength training, and then you go out and you're trying to shovel snow for a long period of time, it's not going to happen. You're going to get burnt out. So activities of daily living become much easier. Injury prevention, right? If you have stronger muscles, it's likely that you have stronger bones, because when the muscle pulls on the bone, that creates that improved bone mineral density. And then that means you're at less of a risk for any type of bone break, fracture. And so those are some things to consider about why it's also really important. Improved body comp, right? So if you have more tissue that is muscle or force producing rather than that is not, overall your body composition is going to look better. Enhanced self-image, improved muscle and bone health, and metabolic and heart health all go together. You know, you're still burning calories when you're lifting weights. Sometimes you're working more anaerobically depending on how you're lifting. Sometimes you're lifting more aerobically or using more of an aerobic base for generating energy. But regardless, you're still burning calories and you're still asking the heart to work at a rate that's higher than at rest. So anytime you ask the heart to do that, you are definitely going to improve your heart health. Metabolically speaking, because your body composition has been improved, because you have more muscle mass, your metabolism is going to be faster. So that means that at any rest period, when you're at home, when you're just doing your activities of daily living, when you are sleeping, you're always going to be burning more calories if you have more muscle mass. Okay, here's some terms, and we've talked about some of these. Some of them might be maybe a refresher for you, but atrophy, I believe we talked about that. That's the reduction in the muscle fiber size. So let's say you've been lifting weights and then you stop for a month, 2 months. That's when the atrophy is going to start. It's really unfortunate, but atrophy happens a lot faster than hypertrophy. So as soon as you stop that stimulus, and it's been 3 weeks, 4 weeks, that atrophy starts to sit in. Concentric action, so a concentric muscle action, that's when, I think I've given the example in class before, if you are doing a dumbbell curl, okay, those bicep muscles, the biceps brachii, for example, they are shortening. And because that muscle is shortening, it's a concentric action, all right? The concentric action is what causes that movement to occur. So you want to lift that lower part of your arm. In order to do that, you have to cause a concentric action within the biceps brachii. The eccentric action is kind of the opposite, right? It's where the muscle is still under tension. It's just now the muscle is lengthening. It's not shortening, it's lengthening. And this is an important piece too, because this is kind of the second half of any lift, perhaps the first half, right? If we're talking about a squat, a body squat, or you're doing a back squat, the eccentric motion is that downward phase. The concentric motion is the upward phase. If we're talking about that dumbbell curl, that bicep curl, the upward phase is the concentric phase, and the lowering phase is the eccentric phase. And it's really important that people learn and follow through with that eccentric phase as well, because the eccentric component plays into everything of activity, dailies or activities of daily living, everything that we do. We request muscles to work eccentrically in order to prevent injury from occurring. So something that really cracked me up, I kind of have to giggle at it, but when I visit LHS often, and I'm in their weight room often, and I was in there and noticed, I think a couple of years ago, so their old weight room, and I was in there while a group of young men were in there, and they were doing power clean. Okay, and they would lift, and then everybody would just throw their bars down. And they weren't maxing out by any means. This was like warm up, low intensity, lifting more so for endurance to start, and then moving up to getting closer to that 1 rep max. And so they were just throwing these bars down, and the whole room, it's just loud. And I'm kind of just in the corner laughing. So I'm like, why are we throwing these bars down? This is not enough weight where you cannot control it eccentrically to set it back down. And I understand when you are maxing out 1 rep max on a power clean, there's a reason you drop that bar. You drop it. You don't throw it though, usually. And anyway, so any part of the lifting where there's that eccentric component, if you can control it, if the weight is not too heavy, you need to complete that portion because it directly translates to everything that we do. Hypertrophy, right? That's the opposite of atrophy. So an enlargement in muscle fiber size, muscle endurance. This was on your test. So you guys know what that is. Muscular strength was on your test. And then we refer to a repetition, right? That's just one complete movement of the exercise. A rep max, that's really just the max amount of weight that could be lifted. However, a lot of people don't 1 rep max anymore. A lot of people are going to estimate, and we'll talk about how to estimate what a 1 rep max is here on the next slide, actually. A set is a group of repetitions, and then a spotter. There's a lot of knowledge that's not, that people don't have about spotters and the role of spotters in lifting. For instance, a lot of people think that when somebody's doing a back squat, in order to spot that back squatter, they should stand behind them and place their leg out in front of them. That's wrong, okay? Because if for some reason that back squat goes awry and the back squatter starts to fall back or whatever, let's say he's got 300 to 400 pounds on his back, there's no way that the spotter can catch that. There's no way the spotter can prevent that fall from happening. And if they stick their leg out in the back, or if they're even just trying to catch them without a leg out in front, they're just trying to catch them with their arms, that's way too much weight for anybody to hold on to, for anybody to catch. So back squat, for instance, there should be 2 spotters, 1 on each side. A lot of people don't know that. Should there be a spotter during power clean? No, we don't need anybody around. Get out of the way, right? So important information about spotting that I think kind of gets mixed, kind of overlooked. All right, so this is this slide that's talking about how one might determine what a 1 rep max is. This is important because there's really a lot of different tables out there that you could use to, figure out what your 1 rep max estimation is. If you're working with an older individual, you're probably not going to have them max out on anything. And instead, you're going to do submax, and you're going to try to estimate based on their submax what their actual 1 rep max might be, because then that's how you prescribe exercise from there. So the way that your book presents how to estimate a 1 rep max based on a submax lift is to, let's just use bench press. Okay, so let's say for bench press, let's say you can lift 60 pounds and you can do it 10 times, all right? The key here is that when you're submaxing, that It's somewhere usually within the 10 to 15, 10 to 12 range. If you start getting on the end of 20 times, you can do 20 reps with that amount. It's not going to be as accurate. Okay, so you would want to up the amount of weight that you have on your bar in order to get a more accurate estimate of what your 1 rep max is. So then you're going to take that 10 reps, right? We said we can do 10 reps at bench press at 60 pounds. And we're going to multiply that by 2.5. So the book makes it really simple with these easy numbers here, right? So 10 times 2.5 is 25. And 2.5, don't worry about that. That's a standard number, okay? That's not going to change. So 10 times 2.5 gives us 25. Then what we're going to do is we're going to subtract that 25 from 100, because this is going to give us our percent estimate of what we're lifting currently. So that gives us 75. This tells us that this 60 pounds that we can lift 10 times is about 75% of our max, okay? Now, all they're doing now is they're just taking 75 and they're dividing that by 100 solely to put that into decimal figure. So that then we can take that original amount that was lifted, which is the 60 pounds, and we can divide that by 0.75, okay? That's our decimal figure. We said 60 pounds is about 75% of our max. So if we take 60 divided by 75, that gives us roughly about 80 pounds, okay? 80 pounds estimated for a 1 rep max. And you see here, there's 2 tables there, table for males, table for females. Any of you that have spent time in a weight room, you're probably familiar with this index table, kind of determining where you might be based on your age. Usually, right, what comes into play here is going to be your weight. That's how we determine what the index looks like. So essentially how much you can lift relative to what your weight is. And if you look at, for instance, the females, okay, 20 years or younger, 0.88 or higher is considered superior. These tables technically, this is for bench press, okay? So these tables are gonna vary based on the type of weight that is being lifted, or the type of exercise, the type of lift. So power clean, for example. So anytime you have, a female that is close to 1 or over 1, that's pretty impressive for what they can lift. If you look up at the table for the males, fair for most of these ages, okay, especially that 20 or younger and 20 to 29, we're looking about that 1.0. So that index starts at a much higher number compared to those females. We are going to do a muscular endurance lab, which I think I've mentioned, and a couple of these different exercises we're going to review right now. One assessment for muscular endurance is a push-up test. And this test, some of you may have done at one point in your life before, but I'm not sure if you've ever done it to a metronome, okay? So a metronome is a set, it's kind of a ticking, and it's set at a certain time. So 60 beats per minute, 40 beats per minute. And the reason the metronome is set is because it's trying to keep the participant, it's trying to standardize this test as much as possible. And instead of saying, okay, you go ahead and you do as many push-ups as you can until failure, a lot of time what happens is people, they just bust out, right? They're going as fast as they can, and then what happens? They start to get tired, and they're barely making it up and barely making it down, and they're so tired. Well, the purpose of the metronome is to keep them on pace. Whereas once that pace is broken or someone's technique is broken, the test is over. So it's just a way to really standardize this test and kind of control it and make sure that everyone is abiding by the same set standards, okay? So there's 2 different types of push-ups, right? Just your regular normal push-up. I want you to look and notice that here his head is forward. A lot of people like to drop their chin to their chest, and we'll talk about why we want to avoid that. The other option, some people refer to this as girl push-ups. That's not the proper terminology, okay? These are considered modified push-ups. So if you're working with somebody, you don't want to say, oh, that's okay, Bill, you can go ahead and do girl push-ups. Poor Bill. Bill's probably going to feel really demasculated there. So what you want to do is call them modified push-ups, and that's another example. Anyone can complete this test doing the modified push-ups. Now this test, it looks pretty easy. I'm going to tell you, it is a hard test. You see how it says this is for youth, is what your book says, but we do it too, okay? There's some available information out there about how you might rate yourself based on your performance in this test. So this one is also done to a metronome, so it's done to a beat, right? So for instance, beep, 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 that means up, down, up, down. And the goal here is all you really have to do is you have to slide your fingers from this piece of tape to this piece of tape. It's super simple, but it's a burner. It's a burner. And again, you do this for as long as you can until you reach that point where you break the pace or your technique starts to change and you're not quite staying up with what the technique recommendations are. So this is another one we'll do. The other one that we're going to do in class is squats to failure. So just body weight squats to failure. And that's one where oftentimes I see that technique break earliest because people real quickly start to not get to 90 or past 90. Their trunk starts to lean forward a lot. So things like that are important, again, just to make the test really consistent, controlled, and standardized. Let's talk about some of the fundamental principles of resistance training, okay? The first term here is called progressive overload. And this is really necessary for any programming that some form of progressive overload must be included in order to ensure that you can continue to exercise beyond a point at which your muscles are accustomed to, okay? I've used that example of that plateau and applying a stimulus so that when you do plateau, you can keep raising your fitness. That stimulus or applying that stimulus, that's progressive overload. And you have to really know when to apply it, and you need to know how much to apply. If you apply too much, we can cause some damage, right? If it's too much, too soon, we can actually cause somebody to go into detraining where they're no longer improving, but because they're not getting the rest that they need, they are perhaps moving backwards. So there's three ways that this is typically accomplished, right? It might be that for any amount of weight that you are lifting, you start to increase the number of repetitions that you are doing. An easy example of this is with even not using weights, right? If we're just talking about using our own body weight for resistance, we're talking about push-ups, we're talking about sit-ups, for instance, or we're talking about those body weight squats. Maybe you've been doing, 20, you've been doing a circuit and you've been doing 20 each set consistently. Well, maybe after a couple weeks, you need to bump that up, right? We need to go beyond 20. Can you make it to 24? Can you make it to 26? So just increasing the number of repetitions is going to apply that new stimulus, go beyond what the body's already adapted to. The other way is to increase the number of sets for a given muscle group. Okay, so overall increasing sets, instead of doing 3 sets, you're gonna do 4 sets. And then the last one, of course, would be to increase the resistance, increase the amount of weight that is being lifted. So again, you guys definitely want to know, you definitely want to have this memorized, that the 3 ways that progressive overload can be accomplished is 1, increase the number of reps, increase the number of sets, And the last way is to increase the resistance. And technically there's no 1, 2, 3. That's not a specific order. There's just 3 different ways. So you can approach that 3 different ways. And sometimes it works that you're doing all of those at one time. Okay. Questions so far? Questions about anything we've talked about so far? I can't see everybody, so if you have a question, again, holler at me. Let's keep going with some terminology here. Regularity, right? We know that exercise has to be performed regularly. It has to be happening usually more than once a week in order for enhanced fitness to occur, okay? You can do something once a week, you can. And maybe it's something supplemental, maybe you're doing some cross training or something like that, where you have it worked into your program to do it once a week. But when we're talking about strength training, it's really important that per ACSM guidelines, we're looking at 2 to 3 days per week. And again, I want to stress why this is so important, because as we age, up till about after age of like 30, 31, we start to lose our bone mineral density at about a rate of 1% per year. That's a lot. So if you aren't doing anything to combat that, then that means your bone mineral density is going to start to really degrade fairly quickly. That's why at an older age, it's important to look at a multivitamin. You know, are you taking calcium? Are you getting the vitamin D that you need? Vitamin D is required in order to help the calcium. That's how the bones absorb the calcium, is through vitamin D. That's why milk is fortified with vitamin D. Are you engaged in strength training? At least, again, twice a week is how we try to maintain or enhance our fitness. Use it or lose it is so true. Okay, use it or lose it. I was just talking to you about atrophy and how quickly that can really happen. So if you're not going to be engaged in it, you're going to lose it. And then the goal is to aim for at least a 48-hour rest period for muscle group training. A lot of people, you know, they like to lift, you know, today's leg day, today's back day, however you do it. If you break it up between upper or lower extremities, core, etc., we're looking for at least 48 hours in between those sessions. Specificity, this is really important because this is that transferability. Okay, so especially if somebody's an athlete, we'll talk about that. Especially if somebody's an athlete, specificity in their training program is essential, because that's how it transfers to the court, to the field, wherever they're playing, whatever their sport is. That means I'm going to look at what their sport position is, and I'm going to break down what they do in that sport position, and I'm going to determine how their body moves, how it works, what muscles are being used a lot, in what way are those muscles being used, at what velocity are those joints moving. I'm going to take all that and I'm going to try to replicate that in the fitness center, in the gym, right? That's how I make it specific to sport play, recreational play, whatever it is. You're trying to take that position, whatever that person is doing, and you're trying to replicate it in the fitness center or in the gym. This is where we see that those adaptations will take place in a muscle or muscle group, and they can be very simple or they can be very complex. And again, this is the example I give here is lunges performed in different directions simulate the steps used during gameplay. Okay, so we think about basketball. Basketball is not a linear sport, okay? Basketball players are not just running straight all the time or moving in the sagittal plane, if you're familiar with planes. They're moving all over the place. They're moving through the frontal plane, through the transverse plane. And because they're moving in all different directions, it's important that they move in that way in the gym too. So that's why it says lunges performed in different directions. Because if we think about a basketball player, right, they're doing some side shuffling, they're getting low, they're stepping backwards, they're pivoting around. All these things are important. So we have to replicate that. Here are the workout components for resistance training. The warm-up phase, this is nothing new. The warm-up phase usually lasts between 5 and 10 minutes, okay? Low to moderate intensity activities and muscular endurance activities. Here's the key that people miss a lot. Let's say, you plan to go and it's an arm and back day, okay? Arm, shoulders, back, perhaps. Well, you go in to warm up, and what you do to warm up is you walk on the treadmill, okay? Or maybe you do a slight jog, or you get on the stair stepper or something like that. The problem with that is that while it will increase your core temperature, you're not targeting the areas of your body that you plan to work. So if you are planning to work the upper body, that means your warm up should be specific to warming up your upper body, right? There's that specificity component. So make sure that you include pieces that are going to specifically target those muscle groups prior to moving into the main portion of your exercise. The muscle conditioning phase, so this is the bulk, right? This is the body of your workout, if you want to refer to it as that. There's different program variables that we need to consider here. And we're going to talk about each of these. There's exercise choice, the exercise order, the training weight, your number of sets, what that repetition velocity looks like, and then what should those rest periods look like between exercises. So exercise choice, right? Single joint exercises are used to isolate a specific body part. What that means is it's single joint. You're only asking one joint to really rotate, to work, all right? A good example of this would be a leg curl or a leg extension. The only joint that is actually targeting or asking to rotate is going to be the knee joint, okay? Whether you're working the quadriceps or the hamstrings, again, that goes back to, are you doing the curl or are you doing the extension? But single joint exercises are just that. They're isolated to target specific body parts. Multi-joint exercises are going to include 2 or more joints, right? So this is when we start to talk about other exercises, such as an overhead press, okay? Overhead press. Now we have the shoulders. Sorry if you guys are getting all these messages that keep popping up on my computer. Now we're looking at including the shoulders and the elbows in this movement. Okay, if we're talking about a back squat, now we're including the hips and the knees. So we always want to select the exercises that are appropriate for whatever your exercise technique experience is and your training goals. If you've never done a power clean before and nobody's ever taught you how, you probably just don't want to walk into it and just give it a shot, okay? You always want to start with lighter weight, right? And make sure you understand that technique and what that technique should look like before you move on to increasing the weight or increasing that stimulus. And the choice of those exercises should promote muscle balance across the joints and between opposing muscle groups. So that means we need to work anterior and posterior, okay? Anterior and posterior sides of the body. Those are those opposing muscle groups. Some are going to be really important and function eccentrically at times. Some are really important functioning concentrically. We have our prime movers, which are agonists, and we have our antagonist, which are opposing that movement, right? So all of these things are really important. We want to include exercises for the lower back and the abdominals, as these increase the control, right? And lower the risk of injury. Ideally, multi-joint exercises should probably come first, and I'm going to talk about that, I believe, in a couple slides here. But these are the exercises that are going to require overall more muscle recruitment. So you want to order these in the fashion where whatever requires more neuromuscular assistance, more muscle recruitment, you want to start with those and then move into those smaller single joint exercises where not as much recruitment is necessary, and it's not going to require as much coordination to complete that lift. So since I just mentioned anterior and posterior sides, right? This means if we're talking about, the role of the pec major and pec minor, you see that's not on there because that's deep, right? Then we need to look at the opposite side over here and see, okay, what else do we need to target to make sure that we're being balanced here? If we're talking about the quadriceps versus the hamstrings, and I believe we've talked in class before about how having an imbalance there can have a very negative impact and put somebody at risk for injury. So important to make sure that both sides are being targeted. So like I said, I believe I was going to talk about this in a couple of slides. Sure enough, large group muscle exercises performed before those smaller group exercises, and multi-joint exercises performed before single joint exercises. And typically what people like to do to kind of go off of that is that usually the core, people like to do the core towards the end of the workout, and that's totally fine. But just keep in mind that the core is going to be utilized for most of these exercises. It's just you're not specifically targeting it during those exercises. The number of repetitions and number of sets, this is based off of ACSM recommendations. So this was really for that 60 to 80% of the 1 rep max for 8 to 12 repetitions. That's what's recommended for adults. That's what we're hoping adults can be lifting at in any given session. Okay, so 60 to 80%. You see that's between moderate and vigorous intensity if we think about that 0 to 10 or 1 to 10 scale. As well as the number of sets, that's going to be 2 to 4 sets. So on a quiz or exam, if it asks, what the recommendation for muscular fitness is for adults, that's going to be that 60 to 80% at 8 to 12 repetitions for 2 to 4 sets. And I would say here, really this is a in between lifting for endurance and lifting for hypertrophy. They'll call this lifting for strength though, right? Key term here that I do like to touch on is this dose response relationship. This is true for anything that we do, okay? Dose response. So I know a lot of you guys probably drink coffee, and the reason that you drink coffee is perhaps you wake up early in the morning or at some point during the day, you feel really tired and you're trying to not feel so tired. So you start drinking caffeine, and the amount of caffeine that you take in is going to determine what your body's response is. All right. So if you take in a ton of caffeine, you're going to be like, I'm wired. I'm ready. Let's go. Okay. But if you don't take in so much, then you're going to be kind of like, all right, I feel a little bit better, but I'm still not quite where I want to be. That's that dose response. However much you dose, that's going to determine what your body's response is. Same thing with exercise. It's not just with muscular fitness, it's with aerobic fitness. How much you prescribe is going to determine what the response looks like. Do I have any questions, guys? Okay. What about repetition velocity? A lot of people don't think about repetition velocity. And for any given adult who's just lifting to maintain or increase their muscular fitness, maybe not lifting for anything very specific, repetition velocity isn't super important. And what ACSM is going to recommend is that you lift at a controlled moderate velocity during lifting and lowering phases. So both your up and your down phases, right? So making sure that it's just controlled, try to avoid any jerky movements. Those are ineffective. You waste a lot more energy and you put yourself at risk for injury. If we were to break this down to a time component, then the goal here would be to lift the upward phase being about 2 seconds and 3 seconds for that lowering phase, just because that usually takes a little bit longer because it is more controlled and it's slower, so that you don't drop the weight or fall or anything like that. But velocity is actually really important when we talk about specificity, because if you think about, let's take a baseball player, let's take a pitcher, not even a pitcher, any baseball player.